My presentation is on nurses' compliance with medication safety, conducted in Enaya Medical Centre here in Qatar. The outline, I will talk about the introduction, medical errors, prevalence of medication errors, medical use system, that is the pathway, the type of medication errors or adverse drug events, relevant to nursing practice, then my recommendations, summary, conclusion, and my references. The introduction. Medication safety standard is an essential part of patient safety and quality management initiatives. The main objective is to prevent harm and negative outcomes of care. Quality management systems are an important factor in promoting patient safety and reducing the risk of adverse events and medical errors in healthcare organizations. Ethically, nurses are expected to do the patient no harm through strict compliance with medication safety standards. Hello?
Yeah. Wait.
Can you share my presentation?
Yeah, see, you can use this navigation. Next page, in the bottom of your page, a top arrow and down arrow is there. You can click that and you can use it.
It's not showing anything.
Okay, you can scroll even if required. Christianah.
Can I continue? Hello? Yeah?
Yeah, you can proceed, please.
Okay. According to the National Coordinating Council for Medication Error Reporting and Prevention, medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professionals, patient, or consumers. The Institute of Medicine, that is IOM, report in 1999 was the first to identify the problem of medication error, with statistical evidence that 48,000 to 98,000 people die yearly due to medical error. In July 2006, the Institute of Medicine found that on average a hospital patient is subject to at least one medication error per day, mostly due to naming, labeling, and packaging problem. Medical mistakes that include medication error have raised concern about medication safety. That was done in 2010. Eliminating medication error is a goal for all healthcare organizations, but the path to this outcome is not always clear, according to Joint Commission International 2015. Medication errors are often complex and rooted in systemic gaps. Lack of medication safety standard and implementation policy is one of the common systemic gaps in many healthcare organizations. Prevalence of medication errors. 10% of all US deaths are now due to medical error. Third highest cause of death in the US is medical error. Medical errors are under-recognized cause of death. Data from most European countries consistently show that medical errors and healthcare-related adverse events occur in 8 to 12% of hospitalization. That is according to WHO 2016. In the United Kingdom alone, an estimated 850,000 adverse events a year, that is 10% of their hospital admissions, were reported in 2000. Spain, in 2015 in their own study, and France with Denmark, they published their incidence, which is also similar to this. But for the developing countries, there's no reliable data. That's why I cannot quote that one. Medication use system, that is the pathway for medication from procurement to storage to prescribing, dispensing, administration, and monitoring. Types of medication error or adverse drug events. A medication error refers to an error, whether by omission or commission, of any step along the pathway that begins when a clinician prescribes a medication and ends when the patient actually receives the medication. That is, from the inception, medical use, from the pathway from procurement to monitoring, the error could occur. Preventable adverse drug event result from a medication error that reaches the patient and causes any degree of harm. It is generally estimated that about half of adverse drug events are preventable, and that's a good news today. Medication errors that do not cause any harm, either because they are intercepted before reaching the patient or by luck, are often called potential adverse drug events. An amenorable ADE is one in which the patient experiences harm from a medication that, while not completely preventable, could have been mitigated. Finally, a certain percentage of patients will experience adverse drug events even when medications are prescribed and administered appropriately. These are considered to be adverse drug reactions or non-preventable adverse drug events and are popularly called as side effects. What is the relevance of this nursing practice? Medication error can significantly affect patient safety and treatment costs and result in hazard for patients and their families. Giving medication is probably one of the most critical duties of nurses, since the resulting errors may have unintended serious consequences for the patient. Medication error can lead to adverse outcomes such as increased mortality, increased duration of hospitalization, and increased medical expenses. Although medication error can be caused by all members of healthcare team, nursing medication error are the most common that is being recorded in the history of the world. Oftentimes, nurses execute their majority of medical orders and spend about 40% of their time in the hospital to administer medicine. The rate of nursing medication error are high in both developed and developing countries, but for that of developing countries, we don't have the accurate data. Studies have shown that almost 1/3 of medicinal complications are due to medication error. Now, my recommendations are adequate staffing for proper nurse-patient ratio. We find out that when staff are adequate, they will be concentrated on what they are doing and there won't be any medication error. So we should adhere to JCI staff to patient ratio. Proper prescription using the standard of right name, right drug, right dosage, right time in a clear and legible written format. Most of the hospitals in developed countries, they are now going to electronics documentation. So I employ most of the developing countries to join this because this could prevent medication error also. Adoption of electronic medication chart with reminders and safety checks. When you have it, it will remind patients, it will remind the nurses on how to give the medication, and if it is in error, it will give an alarm which will correct them immediately. Proper labeling of drugs with appropriate storage facility to ensure preservation of potency. We find out that most of the drugs nowadays have lost their potency because it's not properly being kept. So when we have appropriate storage facility, it could prevent medication error also. Regular periodic medication safety audits for continuous quality assurance and improvement practices. I will encourage all hospitals to have auditing team for medication safety. At least they should go around maybe once in a month to go into other units and check if there's any error. Medication safety charts or reminders for improved compliance with standard guidelines. This one should be placed in a conspicuous place for nurses to see. Then we ask for suggestions and give regular feedback. Report to nurses in respective manner. With feedback, we will know what to do and how to go about the errors. My summary: it may be absolutely impossible to eliminate all medication error. However, the role of nursing administrators in reducing and preventing these errors is vital. More supervision and planning is required for improved patient safety and quality healthcare services. Therefore, managers should have a positive attitude towards the reporting of medication errors by nurses. And this is one of my great recommendations. When they report any medication error, we should take it positively, not with another mind, so people can be able to have mind of reporting their error. In conclusion, error reporting should be seen as an opportunity to understand the root causes and serve as a lead to further conduct in-depth analysis, especially on the effectiveness of the medication safety standards adopted and level of compliance among the nursing staff. This will help nurse managers and hospital administrators to establish, review and update policies and implementation strategies for improved overall compliances with medication safety standards in their healthcare system. So we should encourage all the nurse managers and all the hospital administrators to review and update their policies regularly. And if there's any medication error report, they should take it as in a positive mind and to find a policy to guide against those things. My references are there. Thank you so much for listening.